In today's video, I'm going to be talking about what required a box of Kleenexes recently and why I wanted to use a fly swatter. So before I do that, let's talk about how you can connect with us. If you're local, give me a call at 618-288-1489. If you're not local, that's okay. Go to our website at visionforlifeworks.com and you can read success stories. You can take a quiz there, but you can also schedule a consultation. There's a button for that, actually. All right, so let's talk about the story recently that I heard that really almost had me wanting to use this box of tissues, but involved a doctor giving tissues to someone and walking out the door. Now, in this particular situation, this family was consulting with me because the husband had had a stroke and lost some of his vision. And one of his doctors literally handed his wife a box of tissues and said, "Your husband's now blind. I can't do anything to help you," and walked out of the door. I'm not sure where on earth that is really an acceptable thing to do, although I know that that doctor probably had good intentions and was trying to, show some sympathy for the situation, but really we need to be doing better, which is why the fly swatter is out today, because if I had been there with my fly swatter, I would have wanted to hit him. I can't even say fly swatter and be serious. But in seriousness and not joking about the situation, what an awful thing for this entire family to have to go through, and for that wife to have been told that and given the box of Kleenexes and the doctor walking out. Luckily for them, they weren't just, taking that doctor's advice or taking what he said to heart necessarily, and they decided to go looking for possible improvement and ways that they could help him to be able to see better after he'd had a stroke. Now, that happens to be something that we work with on a pretty significant basis here, probably at least about 45, maybe even 50% of our patients are patients who've had either traumatic brain injury or had a stroke and lost some of their vision. We've had some really amazing results and are very, very blessed to be able to say that. We just had a success story come across our desk literally just last week, in which the person has been able to get their driver's license back and drive again. And that's something that's just really significant, obviously, because when the stroke happens and the person loses their vision, of course it upsets everything in their life. It can affect their ability to drive or go to their job, and maybe their job is impacted to where they're not able to carry that out and do that anymore. So clearly this is something that we need to have maybe a little bit better chairside manner on than just handing someone some tissues and walking out. There are always, lots of things that can be done for strokes and patients who've had memory problems, speech problems, problems with motor ability. And so when we think about that sort of thing, like I'm not sure I understand where there's a part of the brain that says to a lot of these doctors that, we can do all these other therapies, but gosh, you're just going to need to sit and wait and see what happens with that vision. There's nothing that can be done. That's not really the truth. And so with our program, what we're doing is 2 different phases of treatment. The first phase is that we are electrically stimulating the brain and the eyes to work better together, but also just stimulating the brain in the areas of wherever the stroke occurred to be able to turn that back on again. And so if you can electrically kind of turn that area of the brain back on again, essentially you're basically like turning on the visual pathway that was shut down because it lacked blood flow and nerve supply or electrical signals to that area of the brain because of the stroke. So if you're able to turn it back on, then what we're doing is we're just training the brain to be able to bring back vision. Now, it's not a fast process. It does happen over a period of time. And as I've talked about in other videos, depending upon how long after the stroke it occurred, there's kind of a window there that's the best time frame to work with people, which is usually within that first 6 months. But even after that, we have had success. Of course, the amount of success can drop off. And so if a person is 5 years after a stroke, that's going to be a lot more difficult to be able to gain some vision back. But if it's within that first 6 months to a year, definitely there's some huge progress that can be made and significant success. And many of our patients are able to get back to doing a lot of the things that they lost the ability to do before. Now, we have to consult with everybody on an individualized basis, look at their visual fields, and see what else is going on with them and find out all the details surrounding their stroke to know, can we really truly be helping them, and to what extent we can help them. But again, there's a lot that we can do. And we've shown with many of our patients, even after they've graduated our program, sometimes months down the road, they will contact us back and say, hey, I just took my visual field again and got my driver's license back, or hey, I got to go back to work. So we get these stories all the time, even post graduation, which is really exciting. So that could potentially be you, or maybe even your loved one. And if you would like to contact us to find out how we can help, you definitely want to call us if you're local, 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. And probably the best thing to do there, besides read some stuff, is to just click that consultation button and schedule a time to consult with me. Now, if you haven't done so already, make sure you like the video, subscribe, or I'm going to get the fly swatter and swat you. And if you feel like this is a helpful video, please pass it on, because giving someone the opportunity to get not only their sight back, but their life back is, words really can't, describe what that can do for somebody. Thank you.